All right, here we go. I promise this is a great video, and this video is so cool because of my background. My background includes dropping out of high school pregnant, going to the community clinic for about an 8-hour day on 3 buses, or baby daddy driving me after beating me up, whatever. So I go to these clinics, and the whole time I'm there, they never talk about breastfeeding. I saw a social worker, I saw a nurse, I saw a doctor, I saw the WIC office. They never talked about breastfeeding. Instead, they gave away like all this formula and a bunch of toys and gifts with the formula, real pretty packages and the whole nine. Then I went to nursing school, and I was mad at myself. I was mad that I didn't know the benefits of breastfeeding. There was no YouTube or internet or cell phones or anything back then. Then I became a mom again at 30-ish, and then I breastfed. I was like amazed. And then I went to grad school and got a PhD in this. So you're gonna listen because I got good stuff for you. Are you ready? Here we go. This video is about the benefits of breastfeeding to mom. We will do baby after this, but the benefits of breastfeeding to mom. So maternal benefits of breastfeeding. You should have your packet, your maternity packet. If you have your maternity packet, you're gonna write all of this on the front of the packet. Always remember, when you have your packets, you can use the back or the front, and in this case, I used the front. So look what I did. I numbered it just like I'm about to talk to you about the lecture, and I went through all the benefits, okay, and why they're beneficial. So that's what I did. I'll be showing my class that as well when they return next week. So get started because it's a really great lecture. And if you're not in nursing school or taking a HESI exam, this video is also for you if you're just a mom trying to figure it all out, okay? So don't be ashamed or afraid or skeptical as to whether or not this is good for lay persons, because I talk basic. I keep things simple, okay? So that if you want to share this with your daughter, sister, mama, whoever is having a baby, feel free, because I think they will benefit. Here we go. When a mom breastfeeds, and we do look initially at the ever versus never, which means, did you ever breastfeed? Oh, you only breastfed for a couple weeks? That's okay. Did you ever breastfeed? Or did you never breastfeed? Now that's important, because we know that the benefits to mom get better the longer you breastfeed. 6 months, a year, 2 years, great. But even if you ever breastfed, some of these benefits still apply. That's amazing. Let's talk about it. So here we go. Less postpartum hemorrhage. Less postpartum hemorrhage. You know the significance of postpartum hemorrhage in the United States. It's one of the #1 reasons why we are losing mothers, both Black and white. I know you hear a lot about the disparities in healthcare, and that's real. Black women are dying 3 to 4 times more than white. But what you're forgetting, if you're not careful, is that white women are dying too, and we love our sisters no matter what color they are. Right, Kamala Harris? Yeah. I'm sorry, I don't know where that came from. So we want you to know that postpartum hemorrhage is one of the #1 reasons and causes of death for mothers in the United States. So if you can cause less of it, that's always a good thing. But why? I'm not here just to run a list down. I'm going to give you the rationales. So the rationale as to why does breastfeeding cause less postpartum hemorrhage is because when you breastfeed, you are releasing something called oxytocin. Now, you know that drug, you know that chemical. In the hospital setting, synthetic oxytocin is called Pitocin. When the woman has her baby, she's all delivered, we as nurses administer routinely Pitocin to cramp her uterus and make it stop bleeding and to cause involution, which means the shrinking and healing of the uterus to its pre-pregnant size. So we give this mother IV Pitocin immediately after the delivery of the baby and the placenta. And here in our own bodies, if we were just to put the baby on mom and let this baby and mom do their thing and hopefully nurse within that first hour, which is a baby-friendly initiative, she would literally shrink her uterus very fast and decrease her bleeding. Wow. In other countries, this is even a treatment for postpartum hemorrhage because IVs and IV medicine called Pitocin may or may not be available. So the treatment for a lot of patients who are bleeding postpartum in other third world countries is just put the baby to the breast. Another thing I want you to remember, especially nurses or just laypersons, because I've delivered my share of babies outside of the hospital because they were emergencies and they just came. And so if I'm doing a delivery, an emergency delivery, there's a very high rate of postpartum hemorrhage because everything's all uncontrolled. And that patient just needs to know it's okay. Let's put the baby to the breast to decrease your bleeding until the ambulance gets here. You know, you're at Cedar Point delivering a baby, put the baby to breast. Don't cut the cord either. You're at wherever you are and this mom is delivering her baby. Don't cut the cord, put the baby to breast. Let's decrease the very real risk of postpartum hemorrhage. Next is less breast cancer. This has been proven, like it's in the research, and less ovarian cancer for the exact same reason. So I'm going to tackle these two things together. Let's do it. The reason why there's less breast cancer and less ovarian cancer is because of something very fancy called, the reason why people have more breast and ovarian cancer without breastfeeding is called unopposed estrogen. What is unopposed estrogen? Well, God made no mistakes. He made us perfect. In his infinite wisdom, he made it where women are having children, and then after the children are born, women are nursing their babies, and while they're nursing their babies, they are not producing estrogen. You need to know, nurses, that estrogen is contraindicated in breastfeeding. So as soon as the placenta is delivered, this mother's estrogen cuts down and out. That's important because it's estrogen that makes some cancers grow. You know that because you know that we consider hormone replacement therapy and prolonged use of birth control as possibly contributing to breast cancer. In other words, estrogen, any way you bring it, if it's not naturally produced and part of a healthy mother, it can tip the scale into some of this problem or issue of breast and ovarian cancer. Can just tip the scale. There's many causes, so you can't say it caused it, but you definitely can say that hormone replacement therapy and prolonged use, years of birth control didn't help it, okay? So what do we know? We know that if you give a woman estrogen while they're breastfeeding, you will completely decrease or cut out her breast milk. We know that if you just go with nature, and this mother just had her baby and the placenta, estrogen is cut off, and so she gets a break from the very hormone that makes everything grow. And while a hormone that makes everything grow is fine if you're growing a baby, because that's what you have when you're pregnant, a lot of estrogen, it's not fine if you have a cancer because it's going to make everything grow, okay? That's the key. Estrogen makes everything grow, okay? So that's how breastfeeding, every time you have a kid, or at least for a while with one kid, is very protective against breast cancer and ovarian cancer because these two cancers really respond to estrogen. And one of the risk factors of breast and ovarian cancer is not having children like never having children. And one of the protectors, or at least we feel strongly about preventative, is breastfeeding. I hope that helped. We know that when a mother breastfeeds, she burns more calories, and very often that equates to weight loss, and she looks pretty good. Here's the deal. When you breastfeed, you need, because you're burning as much as this, you need, and you better know this, guys, nurses, you need 300 to 500 more calories because you are burning 500 more calories than women who don't breastfeed. I was shocked at how fast I got from my delivery weight to my pre-pregnant weight with my second child who I breastfed. I was kind of shocked. I mean, I started PhD. I started my master's program when I had my second daughter. And I went to my first day of class at Case Western Reserve University, completely lost all of my pre-pregnant weight. And my daughter was about 5, 6 weeks old. It was just class, so I came back home and nursed or whatever. But, it was just, I wasn't back at work yet, but it was a class. I was like, wow. I felt pretty good. Yeah. Okay, so that's that. Okay, let's keep it real. Breastfeeding is free. Yeah, like this is kind of cool. I know that a lot of people think, well, so is formula. No, think again. WIC was free when I had WIC as a teenage pregnant mom, and back then they paid for all kinds of things. A lot of times what I'm hearing a lot of mothers say with WIC now is that they don't pay for what they used to pay for, and therefore you're buying a lot of this formula, and this formula is very expensive. And from what I was hearing people say, the formula cost is so outrageous, and the child never ever has a can that lasts a whole week. So if you think about the powdered formula, that can is not going to last a whole week. And this can of formula, powdered formula, is very expensive. Okay. Contraception. Matter of fact, you know what? Let me just make sure. I want to find out what the price of a can of formula is. So I'm going to look it up while I do this video. The next benefit to mom is that breastfeeding with no supplements, no extra food, no drinks to the baby, no supplementing. That's what that is. Supplement means you're feeding the baby something other than breast milk. And Baby Friendly Initiative says that you need to exclusively nurse for 6 months for the perks of it. I shouldn't say you need to, but it's recommended that you do. I didn't, so my kid and me were fine, but I couldn't, and I'll talk about that in a minute. But the recommendation is if you can, and it's not, messing up your life and interfering with whatever, if you can, you should breastfeed for 6 whole months, because breastfeeding for 6 whole months is, wow, your baby is plenty covered, and the infant mortality rate goes down significantly. So if you were to do that, if you did not give any water, juice, food for the first 4 to 6 months, which is, when they recommend you should kind of not feed a baby anything but breast milk. If you were to do that, then you would literally be protected against pregnancy. But we know how likely it is that moms in America don't do that, because you've got this stupid return to work crap. You don't go to work, you don't get paid. And so you have many jobs making you go back to work at 6 weeks, right? My hospital, just a shout out to the Cleveland Clinic, because I really support this, and I'm really, really impressed with the way they do this. My job at the Cleveland Clinic, my job as a nurse at the Cleveland Clinic, they literally will pay for 3 whole months maternity leave. So while you're off of work, you get paid for 3 months. Talk about baby friendly. If you're a father, you get paid for 6 weeks. Hello? Yeah, that's like crazy. Very few places do that, okay? Let's just keep it all the way 100. So, nurses, come on to the clinic if you're pregnant. I mean, whatever. So I want you to know that, because I think what directly relates to how successful breastfeeding is going to be is whether or not you work for somebody who literally supports your desire to nurse your baby and gives you the paid time off so that you establish breastfeeding on a solid ground for those first 3 months, so that even though you might go back to work part-time, hopefully, you will still be pumping and have pumped. Even while you were at home, you have pumped enough to freeze the breast milk and make it last even longer. See? Okay. So we'll talk about that too. Now, I just looked up the cost of baby formula, and I want you to know what it cost because, you know, it's pretty outrageous. Are you ready for this? I'm going to show you proof. Here you go. I don't know if you can see that, but that's $50. Let's see, $46.99 and $51.99 per that can that may or may not last very long. It's very expensive to formula feed. Okay, so there you go. I thought you needed to know that. Now, so this contraception, let's go back to this contraception issue. If you were nursing consistently, not supplementing at all, it's great birth control. Because you live in America, we know that that is not going to happen, right? Because you're going back to work and God knows whatever else, daycare, whatever. So that's why we say, and you got to remember this, nurses, that's why we say breastfeeding is not a reliable form of birth control. It's not. But let's just say that you are in a secure, wonderful marriage and your husband is holding it down and he has already told you from the time you got pregnant that you could return to work if you want to. It's all your choice whether you do or not. And if you want to go part-time, he got you. And so he knows that he wants the best for his wife and his child. And so you don't have any pressure on you about returning to work. If you want to go, you can. If you don't, you don't. A nurse, one thing about being a nurse, you can always be a nurse. So he literally has your back. Maybe you go back to work PRN. That's fun. And so he wants you to do what you want to do. That's a real man. And so he also says, you know, if you want to have more kids, you can. If you don't, you don't. So you have a situation where there is very, very wonderful family values that make us understand, that have this family understand how horrifying would it be if you didn't take a backup birth control and you did nurse your baby for 3 to 6 to 9 to 12 months to 2 years, and you did not supplement at all for the first 6 months, which is what we recommend. No food, no juice, no water, nothing. And you did all that. 99% of you would never get pregnant that first 6 months anyway, because it is pretty good. I mean, think about it. He made no mistakes. He would like you to spend, God made no mistakes. He would like you to spend time with your baby before another one bounces around. Just saying. Just saying. Okay, so that's the deal. So what do you take to your test? Breastfeeding is not a reliable form of birth control. What do you understand? That God made no mistakes, don't want you to have another baby 15 minutes after the first one. And actually, it's a really good method of birth control for someone in a very, very, very secure family. And it doesn't matter if she, oops, I'm pregnant, because work is not the focus, family is. All right. Now, the next thing is amazing, and that is less postpartum depression. Yes, but there's a but. The reason why there is less postpartum depression is because when mothers breastfeed, they release prolactin and oxytocin. Both of these stimulate the decrease in cortisol. So hear me clearly. When you have prolactin and when you have oxytocin, you decrease cortisol. Now, cortisol looks pretty familiar, doesn't it? When you breastfeed, you literally produce, right? Prolactin and oxytocin, they decrease cortisol. Cortisol is a what? Did you figure it out yet? Doesn't it look like another word? Cort is a very big clue. It's a steroid. What did you learn about steroids? They increase blood pressure. They increase blood sugar. They increase insomnia. This is just regular steroids. And they decrease, you heard me, they decrease your resistance to infection, right? So increase cortisol. Cortisol increases blood pressure, increases your blood sugar, and then it increases insomnia, but it decreases your protection from infection. Then, if you know anything about steroids, therefore the stress response, and you know they can make you irritable, and even anabolic steroids. Remember how you see those Lifetime movies and the guy was on anabolic steroids and he beat up his wife and all this because he's so aggressive? Yeah, well, cortisol is very much, prolonged cortisol levels have been associated with depression and anxiety. So if you decrease the cortisol, you decrease the stress response, you decrease all this stuff, the stress response is decreased because of this prolactin and oxytocin, you don't get the cortisol, you have less postpartum depression. Didn't I say there was a but? What's the but? The but is that's not true if you don't have support. That's not true if you have to return to work in 6 weeks. That's not true if your family's constantly saying, what you doing that for? That's barbaric, girl, grab a bottle. They ain't getting enough to eat, that baby hungry. Oh yeah, I used to hear that. But you know, whatever, you're stressed because you chose to breastfeed and everybody tripping on it. We're getting a lot more support now with lactation consultants, nurse midwives, everything, but that's real. Okay. Bonding. Oh, this is kind of fun. It's been said that when you are breastfeeding, you have a very cool bond with this baby. I think that's true with both of the children, but I will say that I was in a more comfortable spot when I had my second, so there's lots of variables that impact whether or not you're bonding with your baby. I mean, the first time I had a situation where because she wasn't a boy, her dad didn't want anything to do with her and he was kicking my ass the whole time. Yeah, that's not good for bonding, right? Okay. The second time I was married, I planned it. I had a home, I had a nursery, I had a shower. I didn't even have a shower with the first one. What is that? But I'm just saying your life is better. Of course, you're going to be like so receptive and excited about this baby. Okay. Now, so that has to be said. But if you think about the baby friendly initiative, the research literally shows that when you have a baby that you are breastfeeding and you do skin to skin contact in that very first hour of life for at least 1 hour or until the first breastfeeding episode is done, which is just a few minutes because baby is, you know, they're brand new. They don't nurse very long. But when that first contact with your baby, that skin to skin where well, you may be not naked, but you might be naked, but at least all of this is naked, right? And the baby is on you naked, at least on their belly. So belly to belly. And the baby has a blanket covering them so they don't get cold. And you're just holding your baby within the first hour of life. That's the key. Within that first hour of life, is provided everybody's healthy. And your baby actually latches on and nurses during that first hour of life. Number one, you produce more milk than the average mother because you did it the way it's supposed to be naturally intended. Number two, you feel more bonded with this baby. That's so cool. I don't see the problem. Next is you have less diabetes and metabolic syndrome. Now, let's go back to why. Type 2 diabetes, remember that, not type 1, because that's autoimmune. Remember, it's type 2 diabetes. But why? Well, remember I said when you breastfeed, you decrease cortisol. And remember I said that cortisol increases blood sugar and blood pressure. Well, if you're nursing, your blood sugar is not going up. How about that? Plus, you burn more calories. Plus, you tend to lose more weight. We know that all that's related to diabetes. Hello, wake up. Last but never least is when you nurse, you have less cardiovascular disease. What did I just tell you? You release these hormones, prolactin and oxytocin, relaxation hormones, decreasing the cortisol. Cortisol increase what? Blood pressure and blood sugar. And so the mother who breastfeeds has less strokes, less high blood pressure, less coronary artery disease. My God, that is amazing. How cool is that? Because so often we hear about the benefits of breastfeeding for the baby, and that's good. Trust me, I did it for my baby. I had no idea some of this stuff. But it's also the way you're supposed to kind of get healthy as a mom, just having a baby. And who knows, maybe this will help you decide to breastfeed. It's okay if you don't though. What is the baby-friendly initiative? Respect the mother's choice. We've heard that a lot, this whole pro-choice thing we got going on here. Yay, Kamala. Bye. Oh, did I say her name wrong? Yes, I did. Yay, Kamala. Anybody can say her name wrong, but get that vote right. Bye. Yeah, I said that. Deuces.